I take a public health perspective to thinking about how we address the loneliness and disconnection that we're witnessing right now. And I want to ask you, when you hear the term public health, what comes to mind? COVID, STDs, epidemiology, disease prevention. Yeah, public health is actually about systems and prevention. So somebody said disease prevention. It's also health promotion. So we're not just trying to prevent disease, we're promoting things that keep us healthy. You heard Jessica talk a lot about the ways that we can do that as individuals. But I want to talk to you about it from the population perspective. And so some of you may be familiar with this analogy, but imagine that you are walking on this beautiful road in the woods, and there's a lake, and there's a waterfall, and you go by, and there's this person who is jumping off of the cliff, and he lands in the water, and then he's struggling, and he can't get out. And you just happen to be walking by, so you're like, great, I'm going to help him. And so you go in, you help him, and then you go on about your business. Well, then the next day, you're taking the same route, past the same lake and the same waterfall, and another person has jumped off and is struggling to get out of the water, and you're like, okay, gonna help this person too. And then a few days later, you go by the same lake, the same waterfall, maybe there's 3 more people, maybe there's 5. And at some point, public health pushes us to say, why are people jumping off of this waterfall in the first place? Instead of saying, let's put energy into rescuing them when they get to the bottom. Has anybody heard that kind of analogy before? No, okay, so that's what public health is about. We wanna know the root cause. We want to know the root causes of disconnection and the root causes of loneliness, because that's what we have to address to fix the crisis. So public health is about prevention. We want to stop harm before it starts and not treat it after. So if we're at the point where people are already burned out and lonely and disconnected, that's where we're starting to put treatment into place. What we want to do is put systems in place that prevent us from feeling that in the first place. The systems, which is the structures, policies, and environments that we live in, and then population. So we're talking about everyone within our community and population groups, and not just individuals as patients or individuals generally. Another important concept in public health and policy is choice architecture. Who's heard of this term? Okay, yeah, so choice architecture really is what is the architecture around your life that you can make choices from. And the most important thing I can say here is that you can only choose from what is made available to you. So if you live in a poorly designed system or a poorly designed neighborhood or a poorly designed workplace, the only options available to you are also poorly designed, right? And so what shapes our choice architecture? These are things like our built environment. One really great example from public health is we hear a lot about people who have diabetes or live with obesity, and we often hear the solution, you need to eat better, you need to be more active. Those things may be true, but you're not going to solve diabetes and obesity if you don't have a grocery store in your neighborhood, and you don't have walkable streets, and you don't have a car or public transit to get to where grocery stores are or to where gyms are. So we have to fix those problems. It's also about workplace design. Again, remember, we spend 1/3 of our lives at work. So if we design systems where we have heavy workloads, ridiculous, inflexible schedules, and poor manager behavior, that is going to shape our experience of work in a negative way. And finally, social systems. These are things like childcare. And earlier when I was rehearsing, I was like, oh yeah, New Mexico, my home state, is the first state to ensure universal childcare. Why does that make a difference? It means that you're not having to focus on having your basic needs met, like your children being taken care of, right? This is a core function of what we do as human beings, and that you can give some of your energy to other things. This also includes community, policy, and how we create belonging. And this is not just my opinion. This is actually also based in data. Public health people, we love our data. And 90% of well-being is shaped by systems. This is from the Global Wellness Institute. Why did I share this? Well, you see this little red slice here. Most organizations focus on the 10% of individual actions like self-care and personal habits. But I hope the thing that you can see in this image here is that 70% of our well-being is shaped by systems and the people who lead them. This affects every single one of us that operate in these systems. And this is why I do this work, and this is why I do this talk.